Hello everyone, my name is Grace Will and I will be presenting my predictive model for diabetes using SQL. This presentation was prepared as part of the HAP 671 course on healthcare databases taught by Dr. Chinta Pilani at George Mason University's Department of Health Administration and Policy. I am a student in the health informatics field set to graduate in 2023. Diabetes is one of the most common chronic health conditions in the United States. According to the CDC, over 34 million people in the United States have diabetes, and 20% of those individuals are unaware of their diagnosis. In the last 20 years, the rate of diabetes has more than doubled in our country, and it is the 7th leading cause of death. Diabetes costs an estimated $327 billion to our healthcare system each year. The data used for the purpose of this predictive model is from a large health system in the United States. In total, there are over 17 million records in the data and over 800,000 unique patients. For the purpose of this project, diabetes was defined using CSS codes. The CSS codes were then converted to ICD-9 codes, which are used to classify patients as either having diabetes or not having diabetes. Predictors of diabetes were evaluated by finding which ICD-9 codes are highly associated with diabetes. After cleaning the data, over 5,000 ICD-9 codes were found to occur 29 or more times in conjunction with diabetes. Obvious predictors were found as being ICD-9 codes that occur often with diabetes. Some examples include unspecified essential hypertension, pulmonary hypertension, as well as tobacco use disorder. Rare predictors of diabetes were filtered out by those ICD-9 codes that occurred less than the obvious predictors of diabetes, but at least 29 times. Some examples include acute nonspecific idiopathic pericarditis, acute rheumatic pericarditis, and pelvic congestion syndrome. Examples of important predictors of diabetes include other non-follicular lymphoma, unspecified infective arthritis of the ankle and foot, and transient arthropathy. The likelihood ratios were used in the naive Bayes formula in order to predict if a patient has diabetes or not. The sum of all of the likelihood ratios is calculated to estimate a patient's risk of developing diabetes. After cleaning the data set, the data was split into two different sets for cross-validation. 80% of the data went into a training set, and 20% went into a validation set. The purpose of cross-validation of the data is to determine the accuracy of our model used. By calculating the sensitivity and specificity, we create the receiver operating curve. The x-axis represents 1 minus specificity, and the y-axis represents sensitivity. The receiver operating curve represents the accuracy of our model. In summary, predictive modeling is a useful tool, especially in predicting the risk of diabetes within patients. As we saw, some ICD-9 diagnoses are more predictive of diabetes. In doing this, it is also important to make sure the data you are using is up to date, cleaned, and accurate. Thank you for tuning into my presentation.